It's time for us to begin. Good morning, everybody, and welcome. Good morning, PSC members. We're glad you can be part of what is the PSC's very first webinar format of our pre-retirement conference. We have quite a lot to do in our time this morning to early afternoon, so I'm going to kind of give you just a little bit of an overview and some instructions about how we'll be managing things. Our agenda is next after my welcome, Sandra Zaccanetta from the Welfare Fund will be doing her introduction to the entire program and how to think about retirement. After that, Yvonne Rodriguez from CUNY's Employee Benefits Office will talk about the very basics of the process of initiating your retirement from CUNY. Misty Smith, who's from the city's Employee Benefits Program, will be talking about retiree health insurance. And then Patrick Smith again from the Welfare Fund, will be talking about benefits that retirees get from the Welfare Fund. Bill Friedheim, who's the chapter chair of the retirees chapter of the PSC, will tell you a bit about what will happen when you retire and decide to join the retirees chapter. That's a pretty packed program, so I imagine that you won't remember it all, but maybe it'll give you an idea of the sequence of things. We are having our program in what's called a Zoom webinar format. We do have the ability to take questions from the attendees, and there will be times throughout the program when we will be able to answer those questions. The mechanism for doing that, if you look at the bottom of your window beneath the picture of me right now, you'll see a choice that says Q&A, a little icon for Q&A, and it has cartoon bubbles on top of it. If you click on that icon, a window will pop up, and it's a place for you, has a place in there for you to type a question. So once you type your question and then press the send button, we will have received the question, and our plan is to have the person who is the appropriate speaker answer those questions. So it's probably best if you save those questions until the appropriate speaker is on. We will answer the general questions first. So please ask general questions. If there are questions that we can't answer in this session, someone will get back to you with answers. And now switching from my how to do things hat to my union officer hat. I'm pleased. I think that all of you as union members will appreciate the fact that we have benefits, health insurance benefits, we have pensions, and we maintain those benefits in retirement because our union fights for them. I hope that you will continue to support the union while you're an active member and also while you're in retirement. Remember that at some point, when you get to the place where you decide that it's ready for you to retire, you get to make that decision, and you get to claim that you have your freedom from working, a freedom that you have earned, a freedom that unions have fought for, and a freedom that you should certainly take advantage of. Again, thank the PSC for providing you this opportunity to get some guidance, some assistance at the process of transitioning from being an active employee to a retiree. I'm actually here as an attendee in this webinar for the very first time, so I'm joining you as an attendee, and I'm glad myself to have the chance to do it. I guess I'm finishing a little quickly, but that means Sandra can have some extra time. Sandra, do you want to do our introduction about how to think about retirement?
Yes, thank you. Let me try and share my screen. Good morning. And I want to share my PowerPoint before I begin. Okay. I'm just bringing up my PowerPoint and then I will begin. Okay. Hopefully you all see my PowerPoint.
No, Sandra, we're not seeing it.
You don't? Okay. Let me get out of here. Okay, as with everything, these meetings, there's always glitches. So give me a minute.
Good.
You see it now?
Yeah.
Okay, thank you. Okay, we're all good?
Looks good.
Okay. All right, so welcome. Sorry for the delay with the glitch on Zoom, but as you start to think about retirement, you need to begin to do your homework because there are many things to consider when you begin this process. The whole process from beginning stages of your research to actually retiring can be confusing since there is a lot of ground to cover. It is not a one-stop shop process. There are different people with various expertise that you will be in contact with on your path to retirement. And we all have a bit to offer as you begin this process. You will have your experts from HR, experts from your retirement systems, and so forth. It is not a one-stop shop process. As I mentioned, you're not gonna have one person that is going to carry you from beginning to end. So it is a group of people and you need to do your homework. So as you begin to do your homework, one of the first and most important things that you should consider is looking at your Social Security website. Going to Social Security, this is the website, ssa.gov. It is crucial that we all, no matter how young or close to retirement we are, that we go in here and create our My Social Security account. Why do we do that? Because this is all about your history, your work history. You're going to review your records. Your earning records are important to review to make sure that before you get to official retirement to collect Social Security, that your earning record is correct and that you're getting paid accordingly. If you find errors, you will be able to rectify all this stuff with plenty of time. We probably all know that if you retire before your normal retirement age, you will be retiring early. You could retire from age 62 up until your normal retirement age with a reduced Social Security payment. Full retirement age varies for those of us that are born prior to 1960. So after 1960, full retirement age is 67. But depending on your year of birth, your retirement age could be 66, 66 and 4 months, and so it varies. So I suggest that you go into ssa.gov, you have your social security and other information that they will ask you. It is very secure to create this. You will be asked for verification of things that only you have done while you create this. Example, car purchase, where you lived for an extended amount of period. You know, they verify all these things that are relevant to your taxes, to your address, to your purchases, big purchases. Next thing, Medicare. It is important that you start doing your research on Medicare. Medicare, here's the website, medicare.gov. There is a lot of confusion about what to do. I'm 65, I'm not retiring, what do I have to do? If you are 65, turning 65, or have turned 65, and you are still working, you should still apply for Medicare Part A. It's free. It is hospital insurance that it covers. So you have your group coverage, and additionally, you have this from Medicare. So you should sign up 3 months before your 65th birthday, regardless of employment status. Even if you pass your 65th birthday and you haven't applied, apply. It's not too late. It doesn't cost a dime. Medicare Part B, this is where people get confused. Medicare Part B should only be applied for when you are about to retire, regardless of age. Some people get really scared because they hear there's a penalty from Medicare Part B, not applying for Medicare Part B on my 65th birthday. But when you have group coverage from an employer such as CUNY, you're not going to be penalized. And by the time that you retire, when you have your meeting with your HR office, you will be provided a document that you will take to Social Security before you apply for Medicare Part B. And this document is going to say, this person has been on group coverage, all these years, this is when they're gonna retire, and therefore Social Security takes that and there's no penalty, okay? So don't apply for Medicare Part B when you are applying for Medicare Part A, unless you are retiring. You will get guidance from HR, and I will tell you at the end what other guidance you have to know when to do this. So you will sign up for Medicare Part B 3 months prior to your official retirement date. For a lot of you, you will be on annual leave, travel leave, if you have those kind of leaves, when you apply for Medicare Part B to begin the first of your retirement month. So that is crucial. If you are retiring and you are not 65, you will apply once you are officially retired and 3 months before your 65th birthday. Medicare Part B is slated to be monthly $153.30 for 2021. This amount keeps going up. So that's the standard premium. But many of you will see that you are paying more than that when you apply for Medicare Part B at the Social Security office. What is that extra charge? So if your modified adjusted gross income is above a certain amount, you will pay the standard Medicare Part B premium, and this IRMA, income-related monthly adjusted amount, will be added to that premium. It's not two separate premiums, it's one total premium. So IRMA is part of Medicare Part B and is based on your income. So there is a speaker coming after me from CUNY University Benefits Office. That's Yvonne Rodriguez, and she's gonna talk about, benefits and everything CUNY related. But I felt this was important to bring forth before she goes on. And the reason is, this is the #1 question that comes my way at the Welfare Fund. This is the number one question that you should be asking in planning for your retirement, because a lot of people don't even realize that you have to meet certain criteria before you are able to retire with benefits. As Sharon mentioned at the beginning, those benefits are New York City Health, welfare funds that are vision, hearing, dental, prescription drugs. And once you start those Medicare Part B payments, you will be reimbursed for standard and or IRMA reimbursements once you have 1 year of being retired. So it is important that you look at what system you have, TIAA, TRS, or NICERS under a PSC title, and look at your eligibility criteria so that you could retire with all these benefits. TIA members, you need to be age 62 or older. You need to have 15 years of full-time continuous employment with CUNY, be in a full-time PSC title with CUNY, retire from that full-time position, and start a lifetime income annuity from the TIAA optional retirement plan. There are specific materials that were given to you prior to this conference, and you have one document that talks about this, and you will also be talking to your TI advisor about this. TRS members, this also applies to NICERS members in PSC titles. You have to be 55 or older to be able to retire with benefits, have 10 years of credited service with TRS, be in a full-time title, and retire from that full-time position and start to receive your qualified pension plan pension. If you are retiring with under 30 years, depending on your tier, you will have reduced pension for life. So tier 4, age 62, tier 6, age 63 is your full unreduced retirement age. So very important that you know this criteria and that you know it inside out so that you plan for retirement knowing that you're gonna pay for Medicare Part B, but you're not gonna have to assume that cost. You're gonna pay, but you'll be reimbursed. You're going to have 100% coverage in health, Medicare, and your New York City health plan. You're gonna continue with the welfare fund benefits, and you're gonna have Medicare Part D, which is a silver script plan. Patrick Smith will be talking about those benefits later on, and you will have all of that without having to pay money, okay? Now, what to do in your planning for retirement? Who do you talk to? Who do you contact? First, TIA members. You meet with your advisor if you have one assigned from TIAA, or you have an appointment, make an appointment with your assigned TIAA consultant at the college where you work. Part of the materials that you receive prior to this conference includes the name of your advisor from TIAA based on the college where you work. You want to discuss with your advisor if you're on track to meet your income goals for retirement. You're not going to have a salary anymore. Well, what's going to substitute that? It's your income from TIAA, Social Security income, savings, investments, all of that. Discuss the CUNY requirement for New York City Health with your TIA advisor. You're not going to be able to set this up this early on. You're only going to set up this annuity when you retire. However, it is important to know that if you're retiring with New York City Health from CUNY, you are mandated to set up a certain portion from your optional retirement plan as a lifetime annuity, which is one income option from TIAA. So you're probably gonna have a strategy of options, that systematic withdrawals, required minimum distribution, or maybe it's just everything converted into an annuity, which is the equivalent of a pension from TIAA. TRS members, and this also applies to NYSERS members and PSC titles. You want to start looking at those annual benefit statements that your retirement system sends you. It is an annual statement. You're not looking at the quarterly statements. You're going online, you're looking at statements, and it's a yellow orange booklet that has comprehensive information. In there, you want to go and look for the QPP estimate of options. If you have a TDA account, you also want to look at that page. If you do not see any information regarding estimates, that's a red flag. You need to start fixing all of this with TRS or NYSERS. That means your service information is not up to date with your retirement system. You need to contact your CUNY HR office at your college, and you need to request that they send the service record for you to TRS. You provide them with your TRS member number or NYSERS member number, and you request that they send you a copy of that record so that you could see the information just in case there's any errors or that everything is okay. You're also encouraged to attend a TRS retirement class. It is a general class that allows you to understand a lot of the components that goes behind your pension. You know, how do they determine the final average salary for my tier? You know, what is death benefit number 2? What are all these things? TRS offers these retirement classes. Usually it's an on-site program. You know, we all had to revamp and change everything. They are offering these online, and you just log into your account, you go to resources, educational resources, and you will see a list of classes. Lastly, you will contact me if you are in TRS, only in TRS, 3 months. You will contact me for a pre-retirement counseling meeting, but you will only do that if your total service is updated with TRS. I am not TRS. Don't ask me to, you know, update your service, help you sort out your service. Don't send me those service records. That's TRS. So once you are updated, and if you didn't have your estimates updated with TRS in those annual benefit statements, you sort all of that out, and then we meet. Once you do decide to retire, official retirement date, when I ask you when you're gonna retire, when your TI advisor asks you when you're gonna retire, it's not when you're going on Travia. We know you're excited, and for you, that is retirement because you're not physically working since then, but your retirement takes place after you take your annual leave and or Travia leave. So that is what we need to know. When are you retiring after leaves are done? For HEALS, CLTs, you may not know when. You will know the specific date as you get closer to going on leaves, but you will know more or less how many months you'll have of leave, and therefore you could tell us more or less specific months this year. The process, you tell your HR office that you want to retire. You go to HR, you obtain a Travia leave form. HR will tell you how much time you have. If you're a professor, a lecturer, they'll tell you whether you could be out the whole semester on Travia leave, or if not, what time frame you have to be on leave. You will also complete that form and have it signed by your chair and return that form to HR by the deadline. The semester before you go on leaves, you will have a meeting with HR. You will obtain all retiree benefits forms from the HR meeting, discuss those forms, specifically New York City health options, very important, and you will return all those forms to HR. You don't need to call us at the welfare fund asking us where to send the welfare fund form. that whole packet you obtain from HR, you return to HR. You will be going to Social Security office to apply for Medicare Part B 3 months before your official retirement date. If you are 65 or older, you will meet your TI advisor and start discussing this lifetime annuity requirement, which is a requirement if you are retiring with New York City Health from CUNY. TRS members, you are contacting me 6 months before your official retirement date, so I could get you in my calendar to meet 3 months before your official retirement date. We're going to discuss the pension options. I will provide the TRS retirement documents, help you complete those documents, and discuss the overall process to file with TRS. NYSERS members, you are doing this directly with a counselor at NYSERS 3 months before your official retirement date. Make sure you understand Medicare Part B and IRMA reimbursement process, what forms to complete and by when, to begin to receive those reimbursements the year after you retire. Talking about that, you were provided a lot of resources before this conference that were sent to you. It's important that you go over. If you haven't reviewed the information because of time constraints, you were teaching, you were working, that link with resources, very important. Please file it away, save it, because you have links and documents sent to you that are useful, websites that are useful, SSA.gov, Medicare, and so forth, New York City Health, and documents that are useful because they are specific to the retirement system that you have. Example, TIAA members received a specific lifetime annuity guide that explains what that is, what you have to do, and how to discuss that with your advisor at TIAA. And there is one specific guide for each of you based on retirement system and based on age. If you're under 65, if you're over 65, I put together those guides for all of you. And it really is to give you a map of what to do before retirement, while you're applying for retirement, and after filing for retirement from CUNY. As Sharon mentioned before, I hope there's no questions right now for me, because this is very broad. You will have CUNY specifically coming to talk about all CUNY related as as they said, the nuts and bolts, as you retire. And we hope after Yvonne goes, then you ask CUNY specific questions, retiree health questions, and so forth. Then New York City Health is going to speak. So hopefully let them speak. Misty's gonna speak, and then if you have any questions specific to that, then we could address those in the Q&A. And then Patrick Smith will be talking about the welfare fund benefits. He gets a lot of questions. Specifically, you have a lot of questions about prescription drugs. So wait until he does his part, and then you could pose your questions. Thank you.
So I think our next speaker is Yvonne Rodriguez. Yvonne, do you have a presentation that you need to share with us?
Okay, can everybody see slides?
Yes.
Yes, you're good.
Okay. So, okay, here we go. Does everybody can see that now?
That's right, looks good.
Okay, so my name is Yvonne Rodriguez. I am the Director of Benefits Administration. I'm actually filling in for Talene Spengian, who normally does these presentations. So, if there's any questions that you may have following this presentation, you can feel free to email her directly with any questions or concerns you have. Her name is Talene Spengian. Her email is noted below on this screen. It's talene.spengian@cuny.edu. And she'll be able to answer questions more in detail. So today I'm just going to give like a brief overview of what you should be considering as you go into retirement and your eligibility for health insurance. I'll be showing you like a little timeline as to when you should do certain things as you're nearing retirement or considering retirement. And then I'll talk about other topics that you should be concerned about in terms of like Medicare, Travia, and some of the stuff Sandra already mentioned in her presentation right before mine. So I'll just kind of touch on things that she maybe have not covered. So the first thing I wanted to mention is the eligibility for retiree health insurance. For TIA members, basically retiree health insurance eligibility is noted on Article 27.4 of the collective bargaining agreement. For the most part, most of you will fall under section 27.4C. So I am going to scroll to that slide. So this is slide 6. So it's for anybody who was appointed on or after September 1st of 1985. You'd be eligible if you meet the following requirements. You're separated at age 62 or over with 55 years of pensionable continuous full-time CUNY service. You may also be eligible for retiree health benefits as a TIA member if you're separated prior to age 62 with 15 years of pensionable continuous full-time CUNY service. However, there's a little caveat to it, and it's that you have no subsequent full-time employment in a college, university, or other institution of post-secondary education related to the duties that you perform while you're active in service with CUNY, or to duties that you normally perform as the instructional staff. So keep this in mind that if you do retire prior to 62, you've only met one of the eligibility requirements, not both, and that you can potentially lose your eligibility if you do go work somewhere else, as noted in this screenshot. And it's also, this you can find also in the CUNY and PSC agreement. Again, it's Article 27.4C. For TRS, NICERS, and Board of Ed members, as Sandra had mentioned, you must have at least 10 years of credited service. If you were employed on or before December 27 of 2001, you only need 5 years of credited service. And you are working 20 or more hours, and you're eligible for health benefits through the City of New York, and you are receiving a pension check from the pension system. The following is a timeline of things that you should be doing and when you should start the process. It's important, especially for the members who are in TRS or in NICERS, to make sure you verify your service. And it's recommended that you start looking at it at least 4 years prior to you considering taking retirement, but you can also do it within 6 to 12 months before retirement. Some of this process takes long, depending on the pension system. So we encourage you to start early once you've decided that you're looking into retirement. Some people may opt to phase out into retirement. So if you are considering phasing, because you can phase in a period of 1, 2, or 3 years, you would need to start at least 4 years into the phasing, because you need to notify your college that you are considering phase retirement at least a year before you start your phasing period. For those who are eligible for Travia, you'll have at least 4 months prior to the leave to do the paperwork. You should also, within like a 5-month period of your retirement, contact your pension system to make sure you get information from them as to, your options and what you would like to do into retirement, whether you're, like Sandra mentioned, there's a lot of options for you, whether you're doing like just a minimum distribution or you're considering an annuity or whatever it is that you're planning to do into retirement. For the Medicare Part A, again, as a reminder, it's got to be done 3 months prior to age 65. For the most part, unless you're retiring at age 65, if you've already applied for Part A because you're retiring after age 65, we encourage you to do so. As soon as you become 65, you should sign up for Part A. It's free, but Part B, you don't have to sign up if you are still working. When you reach your 65th birthday, and then you can wait until retirement to apply for Part B. There's a premium associated to it, but if you are still an active employee and you're working past your age 65, you can continue to have active coverage and no need to apply for Part B. The Medicare Part D plan, which is your prescription plan, is offered through the PSC Welfare Fund, and like Sandra mentioned, Patrick will be talking about that later on. We are encouraging that you at least 2 months prior to your retirement meet with your HR department and speak with your benefit officer to ensure that you are completing the correct paperwork. And for those who may have the benefits under NICET, we encourage you at least 2 months prior to reach out for any of those benefits, like if you have long-term care or term life insurance. If you want to continue that into retirement, that you speak with them as well about your options for continuation of that and paying for those premiums. So basically, when you're verifying service, you should your college human resources office should be able to complete paperwork for the pension systems that are required. If you do work at multiple campuses, it is up to you to make sure that you have the service verification from all the campuses completed. And like Sandra mentioned, it's always a good thing to review your work history with Social Security Administration and make sure that all the years of service of work that you've done are accounted for before you're applying for Social Security benefits. For those that want to consider phasing into retirement, the option is only available for those who are participants of the Optional Retirement Program, that's TIAA, and it's contingent upon your irrevocable commitment to retire at the end of your phasing period. If you do apply for phased retirement, it supersedes any right to return to work during or following TRAVIA. And you must complete applications by November 15th of every year. So this year will be November 15, 2020. If you're planning to consider phasing starting the next academic year, 2021, 2022. So that's why it takes 4 years for those who want to consider this as an option. Phased retirement for tenured faculty, librarians, counselors, and lecturers with a certificate of continuous employment. You must attain age 65. You have to complete 15 years of full-time continuous service at the time of your phasing. Your work commitment and salary are at 50%, and you can phase over 1, 2, or 3 years, beginning on the first day of your fall semester. You can elect to have TRAVIA paid out in the spring semester of your phasing period. You can elect to take the TRAVIA on your spring semester or paid out TRAVIA in a full lump sum at 100% of salary. But the combined period for phasing and TRAVIA cannot exceed the 3-year period. For those who are in the HEAL title series and have 13.3B status, or for tenure CLTs, it's available if you have attained age 65 and have completed 15 or more years of full-time service at the start of your phasing. The work commitment is 80% of the contractual full-time workload, and salary is at 80% of full-time salary. Phasing for this group of people is from either 6 months or a year, and it begins on the first day of either the fall or the spring semester. You can elect to take TRAVIA after the phasing period and be paid out in a lump sum at 100% of salary. Travia is basically the payout of sick time. So if you're eligible for Travia, you may receive half of the accumulated unused sick leave up to a maximum of 1 semester. This payment doesn't count towards the security benefits. If you have, if you're at the cap, which is 160 days of sick leave, then your Travia payout would be for 5 months. If you're considering taking Travia in the spring, keep in mind that you need to contact your HR department in November. If you're considering to take Travia in the fall, you got to make sure you request paperwork from your HR department in March. And it's very important that you keep in mind that if you are participating in the dedicated sick leave or the catastrophic sick leave bank, this may adversely impact your Travia leave benefits. So make sure that you're considering this, and that if you are considering to retire and want to get paid full Travia, that you review your participation in this program and see if it's going to be to your advantage to stop your participation in the program so you can get the full benefit. The other thing too is that keep in mind that if you are in the transit benefit program, this is the time that you would want to consider adjusting your commuting needs, because pre-tax balances are forfeited based on IRS code. So, and the transit benefit is used for commuting back and forth to work. So if you're on Travia, you'll probably be commuting less. And so you should be able to suspend your deductions so that you're spending down your balance with. And that way you minimize any risk of forfeiting any pre-tax balances. So for faculty members who are taking Travia in the spring semesters, you will be paid out your unused annual leave during the summer immediately following Travia. But for faculty who take Travia in the fall semester and retire immediately prior to the spring semester, they forego the annual leave that's paid out during the summer. So keep that in mind as well when you're considering when to retire and when you're taking Travia, whether it's the fall or the spring semester. Any HEALs that take Travia will have their unused annual leave paid out prior to the commencement of Travia. Just want to remind everyone that there is a cap for annual leave. It's 50 days for ECP members. It's 45 days for HEALs, and any days above these caps will not be paid unless there's a prior approval. But for the most part, the state really doesn't like paying above the cap. So we encourage you to be mindful of your days as you consider retirement and you're nearing that day, that you use as much as possible of your annual leave. Those people who are on fellowship leave for the spring and fall semester, if you are considering retirement, you need to be mindful that there is a 1-year commitment of service once you return from fellowship leave. But Travia does count towards that in that period that you come back. We created a little chart here because we get a lot of questions about, who and when and what is covered. So the way we read this chart, and we'll be able to give this copy to you so you'll have it handy, is that you read on the left-hand side what your status is. So if you're an active employee, which is the first one, then you look at the columns next to it. So if you're an active employee, and let's say you're under age 65, then you're enrolled in city benefits at that point, so you don't have to apply for Medicare. But if you're age 65 at the next column, then you should enroll in Part A if you are age 65 or more, but you still have the health insurance of the city. so you do not have to enroll in Part B. And so, you know, we can look at the next one. So if you are a retired employee already and you're enrolled already as a retiree in the health plan. But for those who are age 65, you have to enroll in Part A, you have to enroll in Part B, and you should also apply for Part B reimbursement. So we find that this little chart is helpful when you're trying to determine whether you should enroll in Part A, Part B, and when to apply for reimbursement. When you are considering retirement, make sure that, you know, we talk about Part A, we talk about Part B, and when you should enroll, but you should not enroll in Part D, okay? That's the prescription coverage, and, you know, that'll be discussed in detail later on in this presentation today. So just keep in mind, do not enroll in Part D because it's provided through the PSC, your prescription drug coverage. We do want to bring to your attention that for retired members, the transfer period, which is, it's an open enrollment period where you can make changes to your health plan, it happens every even year. So this year is an open enrollment for retired members. However, there's a once-in-a-lifetime option where you can make a change outside of that even numbered year. And, you know, just so that you know that it's available, and you must have already been retired for the year so that you can use this benefit. Regarding Medicare, you must apply through Social Security Administration for Part B prior to retirement. It's 3 months prior to your retirement. The forms can be obtained either the Social Security Administration, sometimes your Human Resources Office will have those applications available, so you can always check with them for that. Once you are enrolled in Medicare, Medicare becomes your primary coverage, and the city benefit becomes your secondary coverage. Because you're a retired CUNY member, and if you've met the eligibility for retiree health insurance, you are eligible to get reimbursed for whatever you pay for Part B. That includes IRMA, which Sandra discussed earlier this morning, which is an income-related monthly adjustment amount, and it's actually an additional premium that you pay because your income falls on a different range. And so you're paying what they call the standard as well as IRMA, but all that is reimbursed through the city of New York. So for anybody who's in NYSERS and TRS, those are received reimbursement through the city of New York. There's a form that needs to be completed. They're available at the City of New York's website. They must be mailed to the address here at 22 Cortlandt Street. If you're not, for these group of people, the reimbursement is a direct deposit into the bank account. For TIA members, it's a little different. The TIA members have to go through the University Benefits Office at 395 Hudson Street, so you can mail your applications there. The applications are not the same as the ones the city uses, so you can get those applications online on our website at cuny.edu. They're also available through your college HR benefits office. TIA members do not get direct deposit for their reimbursement, as does anybody who's in NYSERS or TRS, but it's a physical check. So we need to make sure that your address is always on file with us and it's correct, and it needs to be updated through our office. Again, I wanted to remind you regarding the transit program. If you are participating in the transit program, once you're considering retirement, you should also be mindful of reviewing your transit benefit contributions. Once you retire, you have 90 days to spend down anything that's remaining in your account. And after the 90 days, basically you're forfeiting that account, because based on TRS, we're not allowed to refund any unused pre-tax funds. If your contributions are post-tax, because some people have pre-tax and post-tax contributions, post-tax is not a concern because they're reimbursed to you once your account is closed. But any pre-tax funds are not reimbursable. They're not refundable to you, and they're forfeited. So also wanted to remind you that if you're age 65 and you're still working and you're using this, there is some reduced fare through the MTA. There's a phone there that you can call for information on that. And always make sure to verify your account balances and transactions. The current transit benefit provider is Edenbred, and the Edenbred number is up on the screen. It's 833-584-8109. They also have a website. You can have that link. It's on our CUNY.edu website. And it's always good to make sure that you keep your balances, aware of what they are, and that way you will be able to make decisions as to whether you want to suspend or stop or whatever it is that you want to do with your account as you're considering retirement. For those who are participating in the health benefit, healthcare flexible spending account, if you are considering retirement, keep in mind that that you have to do something with this account. You have a couple of options here. You can either have the remaining goal balance taken from your last paycheck, or you can have your remaining goal balance prorated from your remaining paychecks. You can also submit the remaining goal balance on a post-tax basis, either by lump sum or monthly payments, for those who want to continue their healthcare spending account once they retire. Some of you may be enrolled in the 457 plan. So keep in mind that you should also be reviewing not just your TIA or TRS accounts, but you should also review your 457B plan through the New York State Deferred Compensation Plan. You might want to schedule time to review your asset allocations and choose, like your payout options that fit your needs. You should begin, the earliest that you can begin making withdrawals is 45 days following your separation of service from this plan. So for those who are not enrolled in the plan and want to consider this, this is also an additional option to supplement contributions towards retirement. If you are, if you feel that what you have right now won't meet your retirement needs, you may want to look into this and participate in it. So I know Sandra mentioned something about obtaining or getting retirement counseling. So it's very important that you understand that the information provided by the retirement system is what we encourage you to rely on. While we make every effort to provide accurate information, it's the retirement system that have the final say with regard to regulations and requirements for retirement allowances and whatever it is that you want to do with your retirement savings. You can obtain additional information, again, through the PSC Welfare Fund with Sandra, and obviously you always have information that you can get from your CUNY, from your college office, human resources. So some people retire and then they want to come back to work, and that is okay. Retirees are not prohibited from working after retirement. However, there are some income restrictions if a retiree returns to work to the public sector. So there's earning limitations. For 2020, it's $35,000. which means that you can earn up to this amount without affecting your pension benefits. These limits change. Sometimes they remain the same, so we don't know what the limit will be for 2021, but for 2020 it was 35,000. The exceptions to this are employees who are over age 65 or employees that are working for the private sector. It's very important that you maintain your address and any information updated with all the entities that you're going to be dealing with. So that would be your welfare fund, your pension system, your college, the university benefits, so that you're receiving your reimbursements on time. If you're doing again a TRS with the reimbursement, it's a direct deposit into the accounts. You always want to make sure that your banking information is updated so that you continue to receive these benefits. And also make sure that when you're reaching out to us, please include like a daytime phone number or an email address where we can respond to you. It's very important that you make sure that you always have your personal data updated with us, and that way you can always receive information from us, and we'll be able to provide better information. We'll be in continuous contact with you. There's a couple of things to remember. Once you're in retirement, there are certain things that change. Again, TIA retirees must notify our office, which is the University Benefits Office, of any address changes, telephone, email changes, because that's the only way we can reach out to you. That's the only way you're going to be able to get your reimbursements on time without any delays. Please make sure also, even though you're already in retirement, that you keep beneficiary information up to date. That's very important. Sometimes we forget about that once we retire. And please make sure that if there's any changes in terms of like your marital status or anything that may impact your benefits, to please keep us informed. This screen is just, Talene wanted to share a couple of links that you might want to consider. There's the New York City Office of Labor Relations link, which is important. You should be able to go onto that website. There's a lot of information there about reimbursement. They have, videos about what you need to do. They also have some sessions that they'll probably mention, when they come up now. Social Security Administration. So we thought that these would be helpful links that you might want to have. There's also the work-life program through Corporate Counseling Associate, which is available to retired members as well. And so that's it for my presentation. If you have any questions, we can take them later on, or not sure how much we're with time here.
Yvonne, this is Debbie Bell. I've been monitoring some of the questions that have come in. There are a number about Travia. So if you're okay with it, I'll ask you the Travia questions all together. One is, the first is to clarify the date. What is the retirement date if you take Travia? Also, if you have, because you're on phased retirement, agreed to take your Travia as a lump sum payment, how fast after your retirement date do you receive that lump sum payment? And third was, can you take Travia and technically retire from CUNY without taking a pension if you're eligible, if you've reached the years of eligibility for health insurance, and just not take your retirement and can either continue to be on health insurance or wait till you retire to get your health insurance? How does explain a little bit for those who might be thinking about stepping out of CUNY employment early, but have worked for many, many years and therefore are eligible, for some Travia and are eligible for retiree health benefits. Can you still get them if you retire before you're eligible to retire and receive a pension? So those are the three questions, and I'll remind you if you forget them.
Okay, so the first one is, what is your date of retirement if you take Travia? So basically, it's if you take Travia in the fall, your retirement date is when Travia ends. So for the most part, that's sometime end of January. If you're taking Travia in the spring, it's when your Travia ends, but then you have your payout of the annual leave. So your retirement date would be sometime end of August. So it's right after the Travia period ends and any annual leave payout. If you are, if you're phasing out, when is the lump sum payment received? My understanding is that there's really no wait. It's paid out as soon as you're retiring, and the payroll department gets your paperwork, and then they pay out your Travia leave. So there's not like months of waiting for it. And then
Yvonne,
sure.
Just to go back on the retirement date, if you're a HEO and you retire, you take Travia, but you don't have a full semester of Travia, so your retirement date isn't linked to the end of a semester.
So when you're on Travia, you remain on, because you're getting paid Travia throughout. So you're remaining on payroll as if you were actively working, basically. So you're still getting your health insurance because there's premiums coming out of your check. Once you receive your last Travia check, that's your retirement date. So it's the day right after your Travia ends.
Okay. And if you're a HEO and you're getting paid out your annual leave, normally you should get paid out the annual leave before you go on Travia?
That is correct.
Right. Okay, and then that was the lump sum. And then this question of, can you take Travia before you're eligible to receive a pension and still hold on to your health insurance benefits going forward?
So once you take Travia, okay, and you put your bona fide intent to retire, you remain on payroll as if you were active employed until your Travia runs out. Then you're actually in a retired status. So as a retired member, depending on your age or when you're retiring, if you are retiring at 65 or more, then you're eligible immediately for health insurance. So you should apply for the health insurance because you're going to have to apply for Medicare. It's a requirement if you're eligible for health insurance and you're already Medicare eligible that you apply for Medicare. So you'll have your health insurance. You'll also have Medicare Part B because you'll have to sign up because you're age 65. If you want to receive the reimbursement for the Part B, you have to start an annuity in order to do that. So the annuity you have to maintain a reserve for TIA craft members is a reserve of $50,000, and you have to annuitize a minimum of 10. It's a little different for TIA members because that's not something that TRS members and NYSERDs have to do. They don't have to do a reserve, but for TIA they do. If you're retiring and you're not yet Medicare eligible, and you're 62 and over, then you would be eligible at 62 to get retiree health insurance. So you should sign up for the health insurance because you don't have Medicare. So you need something to cover you until you become Medicare eligible. but you retain all that even after Travia. So it depends on where you're at and what age you're at retirement. I'm not sure if that answered the question.
Okay. I would suggest that people who are considering retiring before the official retirement ages should talk to their college benefits personnel and walk through their individual situations. So much of what surrounds retirement is very individual, and I would encourage participants to go to the CUNY website and to go to the PSC website. There are materials about Travia, about phased retirement, etc. One question from a professional staff person is, in the final year of employment, how do they use their unscheduled holidays? Can they just plan to use all 4, or can they only use them quarterly based on when the date they're going to retire?
So unscheduled holidays are also accrued at a certain rate. So if you retire before you technically accrue all your unscheduled holidays, then you would have to pay back that day. So you got to be mindful of that and when your retirement and how many unscheduled days you have used. So I also suggest, you go back to your benefit HR department and make sure that, you haven't overused your unscheduled holidays if you plan to retire and you already had used them. So.
Okay. So just to be clear, because there are a few more questions arising, someone asks the question, do you lose 3 months of salary if you take Travia in the fall and are not paid for the summer?
A lot of people opt to take Travia in the spring because of the payout for the summer. I don't like to say that you lose out on it. Whatever you prefer in terms of when you want to retire. But yeah, so if you do retire, if you do take Travia during the fall and you're retiring, like right before the spring semester begins, then yeah, you're basically forfeiting the summer payout.
And just to be clear for participants, for faculty participants, the summer is the faculty annual leave period for full-time faculty between the graduation date of your college and the first day of the fall semester. So that's the annual leave period. There was a question about that.
Right.
So the questions about accrued annual leave apply to professional staff who accrue leave based on each month that they work. Whereas full-time faculty have an annual leave period in the summer. There was another question about keeping copies of paperwork. From the union's point of view, from the welfare fund's point of view, our answer is have a copy of every document that you have submitted either to CUNY, to your department, to the HR office, or to your retirement system. So a question for you, Yvonne, is in this period when so much is being done remotely and digitally, how do participants request copies of documents that may have been submitted by their departments to HR so that they can have a copy for their file?
So many of us, like you said, are working remotely. So we are encouraging that any paperwork being sent or app forms that you reach out via email to your benefit officer at the campus. Many of them make like occasional visits to the campus, but most of the work is being remotely. So I think email would be the best way to reach out in terms of getting forms and things like that rather than mailing.
Okay. And another question has to do with the healthcare pre-tax deduction account. If there are still funds in that account as of an employee's retirement date, are they lost? How do those rules work?
Is that for you're talking about the healthcare, the
Yes.
flexible spending account?
Yes, I'm sorry. Yes, healthcare spending account.
My understanding is that that they can continue to submit requests, but I'd have to get back to you on that because I believe it's any expenses that were done prior to you separating. Let me look at that and I'll get back to you on that, Debbie.
Okay, thank you. There are a fair number of questions about health insurance and health insurance coverage, which I suggest we hold for Misty Smith, who's going to be talking about that from the city. I'm just reviewing the Q&A to see if there are other things that come in. We have members who themselves are eligible for Medicare and their spouses are younger than 65, and questions about how to handle that. Again, I believe that each individual applies for Medicare themselves. So if your spouse is under 65, that spouse would only apply for Medicare when he or she hits 65. However, am I right in assuming that spouse, if they're currently covered under health insurance, the employee's health insurance, can continue to be covered even though the employee has retired?
So yeah. So if you have a spouse and if you as a CUNY employee are retiring at age 65 and your spouse is not yet 65, you're covering them under your health insurance, under your retiree health plan. They will be enrolled in what's called a split plan, and you will be eligible to apply for your reimbursement for Part B because you'd be signing up for Medicare Part B. Once your spouse becomes eligible for Part B, they will then enroll in Medicare Part B to the Social Security Administration and then can apply for the reimbursement. The reimbursement payments come to the retiree for both. It's not like the spouse gets a separate check for the reimbursement. However, if the retiree is not 65 yet when they retire, but the spouse is, they're still covered under the retiree health plan, but the spouse is now applying for Part B through Social Security Administration, and the spouse can apply for reimbursement even though the CUNY employee who's retired is not yet 65. But once they become 65, they can then apply for Part B and also get the reimbursement. So your spouse doesn't have to wait to get the reimbursement for Part B until you're getting it as a CUNY retiree.
Okay, that's useful. Thank you. There's a question about transit benefit. There are a couple of questions about the transit benefits, and I gather that there have been some issues with funds that were deposited under the old card not being effectively transferred to the Edenred card. I think if I know the union is following up on this issue, so if you have a concern, you should contact your grievance counselor at the union. But for those who are 65, does the university offer a reduced fare program for those 65 and older, or is it just the straight reduced fare program and therefore they should evaluate whether they use up what's been deposited or whether they apply to the MTA for a reduced fare card?
So the university doesn't offer any reduced fare for participants of the transit program. That's reduced fare through the MTA, and you can apply for it directly and get approved through it through the MTA, and then you get your discount reduced fare card. When you're applying for the transit benefit, your contributions are based on your commuting needs, and that's what you can adjust when you're nearing retirement, that you may be commuting less if you're phasing out, or or you're already into Travia, that you are able to reduce that amount for your contributions to the transit benefit. But we don't offer a reduced plan. It's based on what you're contributing and what your own needs are.
Thank you. We have a question from a member who, once they retire and go on to retiree health insurance, will a dependent child under the age of 26 still be covered, assuming Obamacare is still in place, still be covered under the retiree health insurance?
Yes, they will until they age out.
Okay. I've tried to answer a bunch of questions about buyouts. And Yvonne, if you want to disagree with me, you can, but a buyout for public employees in New York City would be legislated by the state legislature. Different buyouts over the years have had different terms. Sometimes it's a buyout to let people retire earlier than the normal age. Sometimes it's a buyout that offers a little extra money to people to retire at the regular retirement age. So it's very difficult to predict the impact of a potential buyout on CUNY employees looking forward. I will say, I'll put myself on the line on this one. Usually buyouts affect TRS and not TIAA. Not always. But in thinking about your own retirement, watch the news. The union will keep you informed if there is a serious buyout bill pending in the legislature, and what the terms are that are being proposed. There are a lot of rumors about this, but we don't know anything. There is nothing concrete as yet, but we will keep you informed. One member asked if he or she sets a retirement date with HR and then a buyout gets approved, will that person be affected? Usually the buyouts have effective dates, and they're in the legislation. So there'll be a little window where you could anticipate if a buyout is likely to affect you. If you say, have told HR you're going to retire at the end of the summer, and it turns out the buyout effective date is October 15th, you may be able to go in and adjust that date, maybe not. But none of this can be answered until we have actual legislation with actual specific terms to inform you about. Other questions?
Is this a time for me to jump in and point out to people that you might find that your question that you were intending to ask has already been answered? If you look at the Q&A panel where you would type in a question, there is a tab that says answered in that panel. So since a lot of people have similar situations and similar questions, you might want to go and look through the answered tab to see if your question has already been answered before you decide to ask it in the box.
And one member points out there is a proposal floating around that enables retirement at an earlier age. I think, yes, there is a proposal floating around, but it hasn't really matured to a sort of likely bill that has a lot of support. But we will the union will stay on it, and we'll keep members informed. I think that's it for most of the questions that I have. One question from someone who asks, very long-term professional staff employee who is not affected by the 45-day annual leave cap, and to some extent this may affect TOs or CLTs who are planning to retire now. because the cap annual leave use date was extended because of the pandemic. Yvonne, if someone is able to accrue more than 45 days of annual leave, will they be paid for their full accrual?
I can find out, but my understanding is that yes, because it's been approved to
Yeah.
be extended in use by the end of this year. I think it was the December 31st.
There's also a question about if you retire from a full-time title, can you work as an hourly employee at CUNY, as an adjunct or as a non-teaching adjunct? And I would perhaps add to that question, during Travia, can you work as an hourly employee at CUNY?
The answer to that is yes.
The answer to both, basically, right?
Yes.
Right.
But there was a limitation on how much you can earn
Right.
in the public sector. How does that work?
So yeah, so if you're already retired and you're collecting a pension, there is a limitation, and it's 35,000. So if you exceed that, it can impact your retirement allowance, and you may be asked to return any earnings that are above that. So you have to monitor your earnings once you're retired and return back to public sector.
And that's a question.
And you're under age 65.
Right. And that's the kind of question that is, again, a sort of personal, situational question that can be, your college benefits staff person can really be helpful in terms of your specific situations. So I think that's it for most of the applicable questions that have been asked. Thank you very much, Yvonne. And there are numerous requests that we distribute to participants a copy of your PowerPoint, which I'm sure you'll be happy to let us do, as Talene always has been. So thank you very much. Back to Sharon.
Okay.
And let me just point out, by distribute, that will probably mean that we will give a link to the place that it is available online, right? So our next presentation is from Misty Smith, the New York City Employee Benefits Program. Do you need to share your screen, Misty?
Hi, good morning. I have a video that's supposed to be shown.
Yeah, Carrie was
Yes,
going to
Carrie.
post it.
So I guess it's time for the video now.
Hi, I'm Ralph Messenger. Thanks for joining us today. The purpose of this video is to help you understand how your benefits might change and what you need to do to ensure a smooth transition into retirement. It can be confusing. I know from experience because I'm a New York City retiree myself. So let me walk you through all the steps, including when to begin the process, how to determine whether you're eligible for retiree health coverage, how your health plan can change in retirement, including how to get information about costs and if you will need an optional rider, how Medicare eligibility affects your coverage, how to get reimbursed for Medicare Part B premiums, what forms you need to fill out, and what happens when coverage terminates. Let's begin by discussing what's required in order to be eligible for coverage. Generally, you're eligible for retiree health coverage if you have the required years of credited service, you are eligible for health coverage as an employee, you'll be receiving a City of New York pension check, or you're a member of a pension system not maintained by the city but covered under special agreement, such as CUNY employees. Eligible dependents include legally married spouse or registered domestic partner, children under the age of 26, and disabled dependents covered prior to retirement. Once it's determined that you are eligible for retiree health coverage, it's important to note that You should begin the application process at least 3 to 4 weeks prior to your retirement date. And you must complete a health benefits application to transfer health coverage from employee to retiree status. Even if you're choosing to waive retiree health coverage, you must still complete an application and select the waive coverage option at the top of the form. We'll discuss forms in more detail later in the video. Also, please keep in mind that unlike employees, retirees are not eligible for the buyout waiver program and will not receive any monetary compensation for opting out of health benefits. You may be wondering whether or not you will be able to change health plans when you retire. In most cases, you must continue with your current health plan. You can only change plans if you're retiring during a transfer period, in which case you'll be able to change your health plan as well as add or drop dependents or add or drop the optional rider. You're moving out of your current plan's service area, in which case you can change your health plan within 31 days of the move without having to wait for the next transfer period. Or you or a covered dependent become eligible for Medicare. Depending on your health plan, you may have certain costs, such as premiums, which are deducted from your pension check, co-pays, which are payable to your healthcare provider, and deductibles, which are out-of-pocket expenses that must be paid before the health plan pays their portion of the medical expenses. If you and your dependents are not eligible for Medicare, your retiree prescription drug coverage is essentially covered in the following ways. Diabetic medications and supplies are covered by all city health plans. Chemotherapy and non-diabetic self-injectable medications are covered under PICA, a standalone drug program for all city employees and non-Medicare retirees in city health plans. Preventive prescription drugs are covered with a $0 copay for all active city employees and non-Medicare retirees enrolled in the GHI CBP plan as a result of the Affordable Care Act. Medications that don't fall into any of the categories mentioned may be covered through your union or welfare fund or through an optional rider under your health plan. The optional rider is a benefit you can purchase to cover expenses not included in the basic plan, such as prescription drugs, private duty nursing and appliances, and an enhanced non-participating provider reimbursement schedule. If you're eligible for Medicare, depending on your union, welfare fund, or health plan, you may be required to purchase an optional drug rider. To learn more about the costs associated with your plan, please review the current rate chart. You can view the chart anytime online here at nyc.gov/HBP. Thanks for watching part 1 of the video. To learn about Medicare, Medicare reimbursement, and submitting forms, continue watching part 2. Welcome to part 2 of the video. Let's start by discussing Medicare. Medicare is available to retirees and their dependents who are age 65 or older or disabled. Medicare Part A is hospital insurance and is available at no cost. It's better to sign up for Part A 3 months prior to turning age 65, regardless if you are working or retired. Medicare Part B is medical insurance, and unlike Part A, has monthly premiums. Medicare-eligible retirees and their Medicare-eligible dependents should enroll in both Part A and Part B in order to receive the maximum city health coverage. Delaying enrollment in Part B can result in ongoing penalties, which can increase the cost of Part B for life. To enroll in Medicare, simply call 1-800-MEDICARE or visit socialsecurity.gov/Medicare or visit your local Social Security office. If you're collecting Social Security, your Part B premiums are deducted from your Social Security checks. If you're not collecting Social Security, you'll be billed directly. In either case, the city reimburses Medicare Part B premiums provided that you're enrolled in a city health plan with Medicare status and a copy of your Medicare card has been received by this office. Medicare Part B reimbursement is made once a year, generally in the spring, for premiums paid during the prior calendar year. Note that any Part B penalties you incur will not be reimbursed. Since Part B premiums are based on income, some individuals with higher incomes may pay higher premiums. This is known as your income-related monthly adjusted amount, or IRMA for short. IRMA reimbursement is separate from the standard Medicare reimbursement. You must reapply every year if you qualify, and your IRMA reimbursement will be paid several months after your standard Medicare reimbursement. Now, let's finalize your health benefits application. Once you've filled out your health benefits application, you must bring it to your agency benefits representative for certification, along with verification from the retirement system of your date of retirement. You or your agency benefits rep must then submit the completed application to this office. If you're eligible for Medicare, you must submit a copy of your Medicare card or Medicare award letter along with your health benefits application. If you're enrolled in a Medicare HMO plan, you must obtain a special enrollment application directly from the health plan and submit a copy to this office. So when does coverage end? Health coverage terminates for your dependent children when they turn 26, for your spouse or domestic partner upon divorce or termination of domestic partnership, if your pension is suspended, or when you die. If coverage is terminated, there are still other options, including purchasing the same health coverage through COBRA, purchasing coverage directly through an insurance company, or purchasing coverage through options made available by the Affordable Care Act. I hope I've helped make your transition to retiree health benefits easier. If you need additional information, feel free to look around our website, where you will find more educational videos, health plan rate charts, information about COBRA, the summary plan description, forms and applications, and important contact information. Please remember that if you move during retirement or there are changes in your family status, you must notify this office in writing about the change. Thanks for watching, and may you have a happy and a healthy retirement.
Okay, so I know a lot of the information was repeated in my presentation on my video that that was repeated earlier with Sandra and Yvonne. So to just jump into the health insurance, in retirement, most retirees continue with the same health insurance plans that they had as an active employee, unless they're moving to a place or a state where their health plan is unavailable. As a retiree, you can transfer your health plan upon your retirement if you are retiring within the transfer period. So this is 2020. This is the even numbered year, and we will be hosting or having a transfer period for retirees starting November 1st through November 30th. Okay. So if you're retiring between November and January, you are allowed to transfer your health plan. Okay. Another qualifying event to transfer plans would be your Medicare eligibility. Okay. If you are age 65 or over and you wanted to transfer your plan, you can do so as well. And again, if you are moving outside of your health plan service area, that is also a qualifying event to transfer your plan upon retirement. So commonly people ask, what is the best plan for me to choose in retirement? Again, this is not a one size fits all, depending on, your needs and your family's needs, this is an individual choice, okay? So I'm gonna go over the current rate chart, which would have the plans and the costs for each health insurance plan.
And for participants' information, the rate charts were included in the materials that were emailed to you earlier this week by Sharon Tong, T-O-N-G-E.
Can everyone see my screen?
No, Misty, we're not seeing it.
Okay, thank you. Okay, can you see it now?
Yes.
Okay, great. Thank you. Okay, so this is the rate chart for retirees. These rates have been updated as of July 1st, 2020. Please note that these rates are subject to change. So just because you retire, let's say, November 1st, these rates are not locked in for life. These rates change. Usually the rates change in January and in July. Okay. So the chart is broken up into two columns or two brackets. The first one is for monthly non-Medicare, as you see on the top, and the second is monthly Medicare. Okay, we have individual, and then we have family non-Medicare. Okay, so let's say, for instance, you're enrolled in the, let's take the first one, the Aetna plan. You're enrolled under the Aetna EPO plan, okay? You're non-Medicare. Non-Medicare means under 65, you're not eligible for Medicare, okay? So the base plan is $368.92 a month, okay? This amount will be deducted from your pension if you are collecting a pension from TRS or from NYSERS. It will be deducted from your pension, okay? You have to keep in mind that your pension may not be finalized for several months, okay? So that means you're getting estimated payments from the pension system. When your pension is in that stage, we do not take out health insurance deductions, or health deduction cost is not deducted from your pension. Okay. Once your pension is finalized, that's when you would have the deduction start. So let's say your pension isn't finalized for 3 months. So you would owe 3 months of premiums, depending on, if you have a health plan where there is a premium that you're responsible for, okay? So with those 3 months of premiums that were not paid, we will not, or you will not have a one lump sum payment deducted, okay? So if you owe for 3 months, you would have arrears. That arrears will be paid over a number of months, okay? So you would have a $35 deduction taken out of your pension until you have, paid the arrears that was owed previously, okay? And if you are, let's say, a GHI member enrolled under GHI basic coverage, there's no premium. So as you can see, there's different plans. Different health plans have different rates. Okay. So again, with the Aetna basic individual plan, the premium currently is $368.92. If you have a spouse, your spouse is under 65, you and your spouse is considered a family. So the family premium is $1,545.42. That will be deducted from your pension on a monthly basis. Okay. And like I said, these rates are subject to change. Those of you who are Medicare eligible, taking the Aetna plan as the example, and you're living in New York, New Jersey, or Pennsylvania, as an individual, basic coverage is $195.09 a month. You don't have to worry about taking what's called the optional rider. Primarily, the optional rider is for prescription coverage. PSC CUNY provides you with prescription drug coverage. So that's a savings to you because that benefit is given to you through your union. So the premium that you would be responsible for with the Aetna plan, Aetna Medicare, is $195.09. Okay, and if it's yourself and your spouse that are Medicare eligible enrolled in the Aetna plan, you would have a deduction of $390.18 a month. Okay, for TIA members, you would receive a bill from the city for your health deductions if you are enrolled in a plan where you have a health deduction. Okay. Now there may be members that may be 62 and you have a spouse that's Medicare eligible, 65. One of you is Medicare eligible and the other is not. So that's what we call or consider a split contract. You have one person that's Medicare eligible and one person that's not Medicare eligible. Okay. So how are those premiums factored? The premiums for the health plan is factored into parts. Number one, let's take the Empire EPO plan. Okay, so one person, your spouse, non-Medicare, you're gonna pay the premium of the Empire EPO base or basic individual premium, which is $1,072.54. And for you as the retiree who's Medicare eligible, you would include, or you would also have a premium of $103.96. So those two premiums combined would be deducted from your pension, or if you're a TIA member, you'll be billed those two premiums to cover the cost of the health insurance. Okay. So wherever plan you're in as the retiree, your spouse or your dependents have to go into the same component, whether it's if they're Medicare eligible, it will be the Medicare component, or if they're not Medicare eligible, non-Medicare, they will go into the non-Medicare component of the plan. Okay. Another example, if you are a family of 3, let's say you have your spouse who's non-Medicare and you have a young adult child, age 24, that's still covered under your plan, and yourself, who is Medicare eligible, what premium are you going to pay? So you have two people that are non-Medicare versus one person who is Medicare eligible. So in this instance, you would pay the family non-Medicare premium, okay? Taking the Empire EPO rate, you would pay $2,720.80 a month, okay? That will be deducted from your pension. Or again, if you're a TIA, you would be billed for that amount, all right? So to discuss the plans, Medicare plans, Medicare supplemental plans, Medicare Advantage plans. What are the differences, if there are any differences between those types of plans? So a Medicare supplemental plan is a plan where Medicare is primary. Medicare pays 80% of the claims, and the health plan pays 20% of the claims. As long as the physician accepts Medicare assignment, the health plan will pay their portion, okay? So again, Medicare supplemental plans, Medicare is primary. It doesn't matter if your physician doesn't accept, let's say, GHI, okay? GHI Senior Care is a Medicare supplemental plan. So let's run through this scenario. I moved to Arizona. The physician that I'm seeing is not a participating GHI doctor. However, I have Medicare. Can I see this physician? Yes. Medicare is primary, and as long as the physician accepts Medicare as payment, GHI will pay their portion. They will pay their 20%. Okay? So it doesn't matter with the Medicare supplemental plan if the doctor participates in the plan. As long as they accept the Medicare assignment, the health plan will pay their portion. Okay? So the city offers two plans like that, which are considered Medicare supplementals, or actually three plans. So the first is the GHI Senior Care. The second would be the GHI HMO Medicare Senior Supplement, and the Empire Medicare Related plan, okay? So with GHI Senior Care, for basic coverage, there's no monthly deduction, okay? GHI Senior Care is considered a nationwide plan. Again, it's a nationwide plan. You can use it throughout the United States. Medicare is primary. GHI will be secondary, okay? With the GHI HMO Medicare Senior Supplement, this plan is primarily for New York State. Again, doctors who accept Medicare, and then the GHI HMO as the secondary coverage. But again, this plan is restrictive to New York State, okay? The Empire Medicare Related plan. Empire Medicare Related is Medicare Supplemental, Medicare's primary, Empire Medicare Related is secondary. And again, you can use that plan throughout the United States as long as the physician, the providers, accept Medicare assignment. It doesn't matter if they do not accept Empire, okay? I just want to stress those points. So with the other plans, the Aetna, HIP VIP, Humana, United Healthcare. With those plans, those are considered Medicare Advantage plans. And with the Medicare Advantage plan, you have to use their doctors, their participating providers. Your Medicare is locked into the plan, okay? There are forms, there are special enrollment forms, or you would need to contact the health plan's customer service so that they can sign you up to be enrolled in one of these plans, okay? And if you choose to enroll in one of these plans, you will be enrolling under a group plan, all right? So again, with the Aetna, Cigna, HIP VIP, Humana, United Healthcare, those plans, you have to use their doctors, their providers within the network, okay? You cannot go outside of the network. You can't go to a doctor who accepts Medicare only. If you go outside of their network, or if you're using a provider who only accepts the Medicare assignment, you would be responsible for those claims yourself, okay? And also, with the Medicare Advantage plans, currently the city does not have a nationwide Medicare Advantage. So these plans are restrictive to geographical areas, okay? Now with Medicare reimbursements, in order to receive the Medicare reimbursement, if you are a TRS, a NYSERS member, you must be enrolled in health insurance as a New York City retiree, and we must have a copy of your Medicare card on file, okay? I know Yvonne had spoken earlier to the TIA population, so you have to follow those instructions in order to receive Medicare reimbursement if you are a TIA member, okay? But for TRS and NYSERS members, again, you must be enrolled in health insurance as a New York City retiree, and we must have a copy of your Medicare card on file, okay? The city reimburses retirees and or eligible dependents for the Medicare reimbursements. However, the reimbursements are only issued to the retiree. So if your spouse is Medicare eligible, it's your responsibility to make sure that you share that reimbursement with your spouse, okay? A lot of times, our office, we get calls from spouses of retirees looking for the Medicare reimbursement, and we would advise them that the reimbursement was already issued to the retiree for the both of them, okay? So depending on how you're receiving your pension payment would determine how you would receive the Medicare reimbursement, okay? So if you have direct deposit with the pension system, those funds for Medicare reimbursement would be deposited into the same account that you use for pension. If you are receiving a monthly check from the pension system, the city would issue you a check for the Medicare reimbursement, okay? Generally, the Medicare reimbursements are issued in April for the prior year, okay? So if any of you are retiring this year, you would receive in your Medicare, and you're Medicare eligible, you would receive the Medicare reimbursement for year 2020 in April of 2021, okay? And it's always prorated from when you were Medicare eligible. So again, If you retired November 1st, you are Medicare eligible as of November 1st, and we received your Medicare card on file. We have enrolled you for health insurance. You would receive the Medicare reimbursement in April, and it will cover the 2 months in reimbursement year of 2020. Okay. Same as with IRMA. IRMA payments are issued once a year for the prior year, and those payments are usually scheduled to go out in the month of October for the prior year. Okay. For example, the city reimbursed the retirees earlier this month, for the IRMA payments that they would have received for reimbursement year 2019. Okay, so it's always the following year. For retirees, you can always change your status. If there is a change of status, if you are divorced, you got remarried, your dependent child, no longer wants to be covered under your health plan, you would need to complete a health benefit application to make these changes. Since our office is still closed due to COVID, we would need the forms uploaded to our link. So let me just get you that information here. Okay, so forms and documents can be sent via email to NYC Retirees HBP at emblemhealth.com. We are also working to have another email address where you can also submit documents. So if you visit our website, that information should be up in a few days, because we're constantly updating our website. So again, we do have where you can submit forms and documents to the NYC Retirees HBP at emblemhealth.com. Okay. Also, let's see. Also, we have our retiree hotline, which is up and running. The retiree hotline is 212-513-0470. I know there are customer service representatives that are answering the lines between the hours of 10 a.m. and 4 p.m. Okay, that's Monday through Friday. Are there any direct questions? I know there's a lot of information that was posed. Is there any questions?
So, Misty, I'm looking at the questions that I'm seeing here, and so I'm just going to work through them here. Will the retiree health insurance prices change in July 2021?
Yes. The prices of the health insurance is always subject to change. So yes, that is a possibility. From my experience, yes.
Okay. Can people transfer their health plans during the open enrollment periods after retirement, or they could? The question is, can they only do it once? I know there's everybody has heard that they have a once in a lifetime opportunity to switch outside of the open enrollment period. But during even numbered years, Can they always change their plans during the enrollment and change period?
Absolutely.
Okay.
Yes. And for retirees, we do send out notices to let them know this is the transfer period. So if you wanted to transfer, you would fill out the form that was mailed to you, and you would upload it to the website so that we can have that processed.
Okay. Some people, or most of our members hear, from their friends who are not city employees about Medigap plans. Are the Medicare supplemental plans available through the New York City Health Benefits Program? Are they like Medigap plans?
Yes. So some people, so the Medicare supplemental plan or Medigap is basically the same thing. It fills in the gap.
Right.
So yes.
What does the rider do for GHI senior care? If they choose the rider, why would they do it? What's the advantage in taking the rider on GHI senior care?
So the rider on the GHI senior care is for 365-day hospitalization. That prevents you from having out-of-pocket expenses. It basically wraps around your coverage so that you are not liable for out-of-pocket expenses.
Okay. Thanks. If a retiree dies before the IRMA or Medicare Part B reimbursements are sent, do they still go to the beneficiaries?
If a retiree passes away, the reimbursements would be issued to the spouse, as long as the spouse was covered under the retiree's health plan. If the spouse was not covered under the retiree's health plan, he or she would need to contact our office so that we can send out the appropriate forms so that we can get that Medicare reimbursement issued.
Okay, someone who's not retiring until March says, how soon do I need to get my health benefit forms submitted?
For the Office of Labor Relations to process your forms, I would say, if possible, 4 to 6 weeks, if possible. We can. I've seen applications where, for instance, I have a member who's retiring on Saturday, and I've been working with her this week to get her paperwork from her HR department. So, I mean, 4 to 6 weeks if possible. If not, I would say within a week or two. I would say at the latest 2 weeks prior to your retirement date.
Yeah, I would say that's the very latest.
Yes.
Okay, here's a lot of people are saying, so how do I switch from my regular GHI to GHI senior care? And that's an easy one. These forms are going to come from your campus benefits office. So when you are deciding to retire, your campus benefits officer is going to give you all the retiree health benefits forms. And that's how you'll make the switch if you have GHI now to GHI senior care. That's how it's done. Those forms are going to come from your campus benefits officer. Here's one that I think applies to a lot of people. I'm currently covered by my husband's health insurance. He's a NYSERS retiree. He's older than me. Do I need to switch off his plan and establish my own CUNY health insurance, or should I, before I retire, or should I stay on his plan?
So the NYSERS spouse is retired?
Yeah.
Okay. So as you can, it's an individual decision. You can remain on your spouse's plan, or you can pick up your own plan. When you, I mean, it may, I don't know if this will be an issue for you, but once you become Medicare eligible, if you remain on your spouse's plan, your spouse would receive the Medicare reimbursement for you.
Right. So it
So
doesn't
maybe
really make that much difference. If your spouse is
right,
a city employee, either way, you're going to get reimbursed.
exactly.
Someone says, who do I contact to see if my husband is a dependent on my plan? That's your campus benefits office. If you're not sure if your dependents are covered, you've got to contact your campus benefits officer and they can tell you. And we have that information at the welfare fund too. So here's a general one. Those of us who have GHI, and most of us do, what's the difference between GHI senior care and the GHI HMO Medicare supplemental plan?
Okay. The difference between the GHI HMO senior care plan, again, the GHI HMO plan is restrictive to New York State. The GHI senior care plan is nationwide. That's the biggest difference.
Yeah,
that's one of the biggest differences. Number two, with the GHI senior care, the base plan, there is no cost. With the GHI HMO plan, there is a deduction or a monthly deduction for that health plan.
How does someone whose spouse is currently covered by another plan, how can I add that? How can my spouse be covered? He's retired. I'm going to retire. Now I want to put him on my plan. How do I do that?
To add a spouse to your health plan, you would need, if this is a new enrollment, you would need to fill out a health benefit application. You would need to provide a copy of your marriage certificate. And if you've been married for more than 1 year, you would need to provide cohabitation documents, such as if you file your taxes together, or a copy of your lease, or a copy of your mortgage statement, something showing that you are financially interdependent.
Okay. If I'm currently in Aetna and I'm going to be leaving the New York, New Jersey, Pennsylvania area, can I keep Aetna or should I switch to another plan?
Well, Aetna is in a number of states. So depending on where you're moving to, Aetna may be available. I know Aetna is in New York, New Jersey, Connecticut, Delaware, Virginia, Florida, Texas, Arizona, Georgia, Maryland, Massachusetts, North Carolina, Pennsylvania, and Washington. So if you're moving to one of those states, you can continue with Aetna if you wish to do so.
If I move out of state, but I'm not going to retire until the spring, do I need to change my health plan now or wait? I guess that depends on the plan you're in.
Mm-hmm. Yeah, it depends on the plan that you're in. It depends on if you're moving to an area where your current health plan is not available. So if you're moving somewhere where your health plan will not be available in retirement, then that will be a qualifying event for you to transfer at the time of your retirement. or again, if you are Medicare eligible, when you're retiring, that's also a qualifying event for you to transfer.
Okay. When I die, is my surviving spouse still going to get the Medicare Part B premium reimbursement?
Your spouse would only receive the Medicare reimbursement up until your demise. And again, if your spouse was covered under your health insurance plan.
Okay.
So once the retiree passes away, the Medicare reimbursement would be terminated, such as the health insurance would also be terminated.
Right. If I retire and I move out of the country, do I lose my New York City health benefits coverage?
The only health plan that would cover you outside of the United States would be the GHI CBP plan. And that's due to the fact that GHI CBP has the non-participating provider. You can use that plan nationwide, worldwide. However, obviously you will be going out of network, so you would be subject to, their deductibles and co-insurance.
Right. And people should be reminded that Medicare does not cover you outside of the United States. They're asking, could you scroll the screen down a little bit so they can see the bottom of there we go. There we go. Some members say I'm bombarded by all this information on Medicare plans. Would these, if I took them, would they replace my, say, my GHI senior care plan?
Yes, if you're enrolling in a plan not through the city of New York, number one, and you're Medicare eligible, you would not receive the Medicare reimbursement from the city because you're enrolling into a plan that's not through the city of New York. Yeah, so it would replace the plan that you have through the city.
A question about where's the information on the different emblem health plans under monthly Medicare? So if you just go and search NYC Health Benefits Program, you'll get to the NYC Health Benefits Program website. And then if you just search rates on that site, you'll see the rate chart that Misty had put up a little while.
I can share that again. Let me see.
And while you're looking at that chart, folks, here's a question. What is the difference between GHI Senior Care and the Empire Medicare related plan?
With the Empire Medicare related plan, you do not have deductibles. With the GHI Senior Care, you are responsible for Medicare deductibles. So for instance, the Medicare deductible that you have to meet before Medicare pays is approximately $198 for the 2020 year. And then there's a deductible of $50 that you must satisfy before GHI pays their 20%. So with the Empire plan, you don't have the deductibles, but with the GHI Senior Care plan, you do have the deductibles.
Here's a good one, good general question. Can spouses have each other on their corresponding health plans? If my spouse works for the Board of Ed and I work for CUNY, can we have each other as dependents on both of our plans?
No, because that's considered double city coverage.
Right. So you got to choose, folks, one or the other. If you're both city employees, you just have to decide, or you can stay separate. It's up to you. People always do wonder about the difference between the GHI and GHI-HMO. Is there differences? I mean, there's differences in cost. Is the care different? Is the coverage better under one or the other?
No, it's just deductibles, co-payments. It's different. It's different.
If your spouse is not a city employee, you've always been on, this question is, I've always been on my husband's health plan. He's not a city employee. Should I stay on his plan or should I take out my own?
That's an individual decision.
The big difference is if you stay on his health plan, the city is not going to reimburse your Medicare Part B premiums, right?
Yes.
So the big advantage to enrolling as a retiree on your own, and you could include your husband as a dependent, is that you get that Medicare Part B reimbursement. If you're not enrolled in the city retiree health benefits, you're not eligible for the reimbursement. When I, as the retiree, die, does my spouse continue with the health insurance for life?
No.
No, that is a big no. Under the welfare fund, I'll be talking about this in a little while. There is a survivor benefit that you can, it's a very good deal, but we'll talk about that in a minute. Is Aetna the only plan for residents of New Jersey?
For Medicare or non-Medicare?
Let's say Medicare.
Okay. So for New Jersey, there's the Empire Medicare related, the Empire Medi Blue plan, and United Healthcare.
Okay, I'm scrolling through here to see. Basic question. I currently have GHI. Is this available to me in retirement? Yes. Before 65, you're going to keep that plan if you want it. After 65, then if you're reasonably happy with GHI now, there's no reason not to take GHI senior care. And that is what most New York City retirees do. I think that is pretty much it.
Okay.
Oh, it says, do we indicate that we want GHI senior care plus the rider when we're filling out the city health benefits application? Yes.
Yes.
That's exactly what you do.
Yes.
That is what that application is for. Can I change plans before retirement? During the open enrollment and change periods, yeah. That's when you would do that, before you retire.
And the open enrollment for active employees, it's always in the month of October. So currently we have an open enrollment period for active employees that runs from October 1st through the 31st.
Right, we are just about at the end of that.
Right.
Let's see, I just want to get this, I think we did mention it. If an employee dies while actively employed, what happens to the dependents on that coverage? Let's say, now we're just not talking about retirees. It's like, if you die in service as an employee, Your dependents, what happens to their health insurance coverage?
If you die in service,
Yeah.
if you die in service, usually coverage for active employees and their dependents would be terminated.
But they do have the option to COBRA, right?
Yes, yes.
And
yeah.
then
And the COBRA forms should be given to or should be sent to the surviving spouse
right.
or dependents.
Would
Yes.
go from the campus benefits office. So
Right.
if a retiree who's enrolled in health benefits from the city of New York retires, what happens when the retiree dies to the dependents on the plan?
Once the retiree dies, the health insurance would be terminated as well. And we can send out the COBRA package to the surviving spouse. And we also have the COBRA forms on our website as well.
And a member says he's covered by his veterans benefits. Does he have to sign up for Medicare?
So he's getting coverage through TRICARE. If the coverage is through TRICARE, I'm not sure if TRICARE requires the Medicare A and B enrollment. So that's a question for TRICARE.
You should check with his VA benefits provider
Yes.
about that.
And thank you for your service.
Definitely.
Pat, can I ask one question? This is Debbie.
Yeah.
For those employees where both the spouse and the retiree have earned city retiree health benefits, and therefore the indication was one person stays enrolled. You can't have two plans with both of them on either one. But so let's say one of the retirees has the spouse on the plan. If that retiree passes away, what should the surviving spouse, who in fact is eligible for city retiree health benefits, do?
So the spouse should contact the Office of Labor Relations, provide a copy of the death certificate for the spouse, and fill out a health benefit application requesting to pick up his or her own health insurance upon the death.
Right. So the dependent on a deceased member's plan who's eligible for health coverage is not going to lose it. They'll take on their own plan.
Exactly.
But they have to actively seek that.
They've got to do it. It's
Yes.
not automatic.
Not automatic.
And Misty, they would be notified. I mean, when the city learns that the spouse has died, does that automatically trigger notice going out to the dependent?
No,
They have to do
because
that.
we can. The surviving spouse would have to actively contact us in order to initiate that. We wouldn't initiate that automatically.
So I think that's it for the questions that I am seeing. I think we covered. Yeah. So we're almost ready for the next section.
So that's you, Pat.
Yeah, thanks, Misty, for the presentation. Thanks, Pat, for handling the questions. I think, Pat, you're the next presenter.
All right. So I'm gonna now go into the horrible, risky position of sharing my screen. So bear with me if it doesn't happen immediately. Before I do that, though, let me just say, I'm going to keep talking while I go to my thing. So thanks to everybody for participating in this. I know it's been a really long morning, and we are in the home stretch here. This bit is easy, and so here we go. This is what we'll all look like happily once everything is over and we can go travel and have fun. And so your welfare fund benefits, what are they? They are everything but your basic health insurance plan. If you retire under 65, nothing's going to change for you. You're going to, or not nothing, but most things are going to stay the same. If you're over 65, you're going to enroll in Medicare, and these are going to be supplemental to your Medicare and your Medicare and what we call that Medicare supplemental plan, GHI senior care. These are the other benefits that you've been using as a retiree, as an enrollee in the welfare fund. So just quickly, so you know what the welfare fund is, we provide these supplemental health benefits, and it is confusing because once you're in Medicare, that GHI senior care plan is also called a supplemental plan. But these are the other benefits that you've been using. And this little chart shows you where most of the money goes. And where does the money come from? It comes from from CUNY via the city of New York or via other ways. It's not your union dues. That's the point. These benefits are not paid for by your union dues. These are paid for by the city. Per capita contribution goes to the welfare fund to pay for these benefits as your benefits as an active employee and a retiree. Most of the money in the welfare fund budget goes to the drugs. You can see on our pie chart here, and that shouldn't surprise you because the drugs, as you know, are expensive and getting more expensive by the moment. The big chunk of the budget then goes to dental, and then you can see the rest is divvied up amongst vision, disability, death benefit, hearing aid, that kind of thing. Although your union dues don't pay for these drugs, your union negotiated along with the other unions of the city of New York to get these. So even though your union dues aren't paying for them, your union dues make these kind of things possible because the union negotiates for these benefits. So prescription drugs, this is the big crucial thing. So when you retire, if you're under 65, you're going to continue to use that CVS Caremark drug card for your prescriptions. As an active employee, if you're currently getting injectable or chemo drugs from the PICA program, the New York City PICA program, which subsidizes those very expensive drugs, that will continue if you're under 65 when you retire. And as an employee, if you're on diabetic medications, those have been provided by your basic health plan, GHI, Blue Cross, whatever you've got. That's state law that diabetic meds are covered by your basic health plan. And if you're under 65 when you retire, that will continue. If you're over 65 when you retire, all the drugs will come through the welfare fund SilverScript Medicare Part D plan. So you will no longer, if you retire at 65 or older, you enroll in Medicare, you're going to get those drugs through your Medicare Part D plan. You won't need to mess around with the PICA card, and you won't be using your basic healthcare card. You'll be using the Welfare Fund SilverScript card, which is a Medicare Part D plan. So when you sign up for Medicare at age 65, as a retiree, you'll sign up for Part A and Part B. Do not sign up for a Part D drug plan. The Welfare Fund will enroll you in the Welfare Fund SilverScript Medicare Part D prescription drug plan. You'll get that enrollment form if you're turning 65 as you retire. That SilverScript Medicare Part D enrollment form will be part of the forms you get from your campus benefits office. If you turn 65 after you retire, then we'll send that form to you. But the big thing to remember is, I mean, you've got a lot on your plate, but when you sign up for Medicare, A and B only. And you're going to be getting tons and tons, I mean, you already are, tons and tons of come-ons from different insurance companies to sign up for their plan. And there's a lot of Part D drug plans out there. You don't need to pay any attention to that. You're going to get that form from the Welfare Fund. Most Welfare Fund benefits don't change when you retire. You're going to retain your dental plan, whether it's Guardian or Delta. You're going to retain your Davis Vision benefit. You get those free glasses if you choose the frames from Davis Vision, and that benefit is every year now. Every 12 months, you can get a new pair of glasses. And you don't have to get the free ones. You can you can get designer frames. You pay for it at a discount. As long as you are using a participating Davis provider, you can use that benefit every 12 months. If you choose to go out of network, it's just like now, you can use it every 24 months and get reimbursed up to $200. Hearing aids. Hear USA remains your hearing aid provider in plan. That's a very rich benefit from the Welfare Fund. If you're not familiar with it, it is $3,000 every 3 years, $3,000 off the price of a hearing aid. Hear USA offers devices from 11 different manufacturers. It's a very good deal. At the basic end of the devices, you can use your Hear USA benefit and get a free hearing aid. As the devices become more sophisticated and more computer programmable, they go up in price, but the price is always discounted and you get $3,000 off the top of the price. So we do encourage you to go in network for hearing aids. If you go out of network, the benefit is significantly less. It's $500 every 3 years. But these benefits don't change. They continue through retirement, along with your prescription drug benefit. Some things do go away. Disability insurance is income replacement for employees who are unable to do your job. Once you retire, we're not replacing income for that. So that ends. The death benefit for employees that die in service discontinues. And if you have GHI now, that extended medical benefit that reimburses you for out-of-network, out-of-pocket costs if you have to use non-GHI providers. Once you're in Medicare, that does go away. Dependent spouse benefits do end upon the death of the retiree, but there is a Welfare Fund survivor benefit, and it's a very good deal. It includes all of the Welfare Fund benefits, drugs, dental, vision, and hearing aid for about $1,700 a year, and that is a very good deal. That's much cheaper than if you had to buy a Medicare Part D plan on your own as a survivor. So what happens to the insurance, the extra insurance premiums that you are paying for by payroll deduction right now? If you have the catastrophe major medical plan from the welfare fund or from NYSET, or if you have currently MetLife long-term care, that is on payroll deduction. If you have the welfare fund Hancock plan, that's been discontinued from payroll deduction for a long time. Or if you have term life from NYSET, any of these things that you're paying for by payroll deduction, what happens? You must contact each insurer. Call them up. You make sure they've got your correct mailing address, phone number where you can be reached. You tell them what your last payroll date is going to be, and you ask to have a bill sent to your home. That's standard practice. They will, once you tell them that you're retiring, you will be getting a direct bill. The first premium payment for things like catastrophe major medical or MetLife long-term care or NYSET life insurance, the first premium payment has to be a paper bill sent to your home. After 6 months, you'll be able to arrange to pay for these things by automatic deduction from a bank account, from your TIAA annuity, from your TRS pension. You have a lot of options for arranging for automatic deduction. And we do recommend that you do that so that you don't have to remind yourself to write checks. But the first thing, the first payment after you go off payroll, the first premium payment has to be a direct bill. So the first one you do will be a check that you're writing. After that, for about 6 months, usually it's the second billing cycle, you'll get a form in the mail from the provider that allows you to arrange for automatic deduction. So, where's the best place to get information on your welfare fund retiree benefits? And that is the welfare fund website. How do you find where it is? Go to Google. Google PSC CUNY welfare fund, or whatever browser you use. Don't try and remember the URL for this site. The string of characters is too long. You'll never remember it. It's too confusing. So just use your browser, whatever you use, Google, Yahoo, whatever. Search PSC CUNY welfare fund, and you will find our site. And that really is the first best place to get very clearly explained descriptions of your drug, dental, vision, and hearing aid benefit. We also have the phone numbers for our benefit vendors, links to campus benefits offices if you need to get back in touch with your school. Lots and lots of useful information on the site. And during this COVID pandemic period, any kind of special emergency information is highlighted on our homepage. So when you have a minute later on today, I say not a bad idea to check out the Welfare Fund website if you're not familiar with it. I am updating it every day. Whenever there's any kind of important information, especially changes to your benefit, and they don't change very much, but when there are changes, we post it on the site, and of course, we contact you with anything that we really need you to hear. You'll be hearing from us by paper mail and email, but general information is really the Welfare Fund website is the place to go. How do you reach us? When in doubt, communications at PSC CUNY Welfare Fund, and this email is also linked on the website. You realize we're all working from home, but you can call our general office number and leave messages. Some of the phone numbers roll over directly to our staff's cell service. And if they don't roll over, they leave a message with that number. So it's very easy to get in touch with us. And as I said before, the website has lots of information that can answer your questions right away, lots of FAQs. And that is it for my PowerPoint.
So there are some questions here. I'm gonna read them to you.
Okay.
First one, is there a maximum amount coverage for the Silver Script prescription plan?
There is no max. The Affordable Care Act says there cannot be any max on insurance coverage.
Okay. Can we switch from Guardian to Delta? And if so, when?
You've got one day. This is it. Tomorrow is this day. So if you get those forms in by the end of the day, today or tomorrow, you can switch. And those forms come from your campus benefits office.
Do I pay premiums to Medicare for Part D even if I don't sign up for it?
Well, if you're not enrolled in the welfare, if you don't sign up for the Welfare Fund Silver Script Medicare Part D plan, you're not going to have drug coverage. So you're not going to get any premiums for Medicare. Assuming that you've enrolled in the Welfare Fund plan when you fill out your retiree benefits forms, you'll be covered by the Welfare Fund plan. We pay the premium. We pay the front end deductible, and we carry you through the coverage gap that they used to call the donut hole. So that's a very nice thing, and you do not pay for that. However, if you have an income that is over the threshold and you're subject to the income-related monthly adjustment amount for Medicare Part B, you're also subject to that IRMA surcharge for Medicare Part D. That you do have to pay. You will have to pay the IRMA surcharge for Medicare Part D. Unfortunately, that surcharge is not reimbursable. The Medicare Part B, as in boy, surcharge is reimbursable. Every year that you're charged it, you can submit for reimbursement the next year. So the only premium-related charge for your Medicare Part D Silver Script plan from the Welfare Fund would be an IRMA surcharge. If your income is under $85,000 a year, modified adjusted gross income as an individual is under $85,000 a year, or $170,000 if you file jointly, you will not see any premium charge for Medicare Part D. If your income is over those thresholds, then you will see a charge. And depending on how much over it is, the charge will go up. You can see those rates if you just Google Medicare Part D IRMA. Just Google that. You'll see a chart from Medicare, the Center for Medicare Services website that will tell you what that IRMA charge for Medicare Part D is. But the basic premium for Medicare Part D is covered by the Welfare Fund. The front-end deductible is covered by the Welfare Fund, and you never lose coverage during the coverage gap that most Americans have to mess around with.
Okay. This question is for Patrick. PICA is charging a basic cost of $120 just for the pleasure of applying for my testosterone RX plus an additional fee when I need a prescription filled. This is not acceptable, so I use Good RX for my prescription at a cost of $44 for 5 cc's instead of a total gross cost of $120. Will Silver Scripts pick up this cost, or as with PICA, am I still on my own?
Silver Script will cover differently than PICA. PICA is using Express Scripts, right? That's the pharmacy benefit manager for PICA. Silver Script is a Medicare plan, Medicare Part D. So the coverage does change. To get the quickest answer to that, I would say contact our prescription drug staff at the welfare fund and just ask them, how much will this drug cost if I'm on SilverScript Medicare Part D? They can answer that question. So you can, if you want to send me an email at that communications email address, I will forward it along to the welfare fund drug folks, or you can call them directly. All of those contact numbers are on the welfare fund website. I would say just ask them. I can't tell you off the top of my head what that drug will cost under Medicare Part D, but it will be different. The coverage will be different because Medicare has more stringent rules for retirees than, say, Express Scripts or CVS Caremark for people who are not in Medicare.
I am 66 years old and an active employee. Should I drop optional disability?
No, because if you continue to work, you can still get, let's say you don't intend to retire. Although if you're in this thing, you're probably gonna retire. If you're gonna retire within the year, go ahead and drop the disability rider, because you'll still have the basic plan and you're not gonna be using that coverage. But it's important to know that, let's just say you're in on this, but you're not really intending to retire right away. If something would happen like today, and you can't continue working, you can still get income replacement up to age 70. So if you're 66, that's 4 years of income replacement, and that has value. There's no need to drop now. If you're intending on retiring within the year, certainly you can drop that, and you need to contact Jennifer Melfi at the Welfare Fund. Send me an email at that communications website, and I'll forward it along to Jennifer, or I'll send you her email address. You can find her email address on the Welfare Fund website. All of our staff emails are on our contacts page on the Welfare Fund website. So just let me reiterate. If you're 66 years old and you don't really know exactly when you're going to retire, you should hang on to that disability benefit because it pays more than the basic. All employees, whether they've taken that optional disability plan, are covered by the basic plan, which reimburses at 50% of your pre-disability salary. The optional plan that you're paying that payroll deduction for increases that income replacement up to a rate of 60%, and it also contributes 10% of your salary to whatever retirement plan you're in, TIAA, TRS, NICERS. So there is certainly no need to drop it unless you're intending on retiring within a year.
And I don't know how to contact life insurance and catastrophic medical insurance. Where can I find their emails?
Okay, on the Welfare Fund website, there's a big menu bar at the top of every page, and the page that says contacts has all of the emails and phone numbers for those plans. If you want to contact the administrator of the Catastrophe Major Medical Plan, Mercer Consumer, we've got the phone number and the instructions for how to handle their automatic answering service. Any NICET plan, you need to talk to NICET directly. And the number for NICET is also on that contacts page. So again, that's another place where the Welfare Fund website has all of those phone numbers.
How do I enroll in extended coverage if I don't have it already?
Say it again, Sandra.
How do I enroll in extended coverage if I don't have it already?
The enrollment form is on the Welfare Fund website. So if you want to enroll in that now, it's a little, I wouldn't bother if you're going to retire, within the year. There's no need to do it. But if you're planning on working for a while, it's certainly worth it. And the enrollment form is on the Welfare Fund Forms page, and it's in the section Forms for Enrolling. You'll see it.
There are two. Okay.
Listen.
There are two questions that are similar. Can I use this service in GA dental and vision if I am under my spouse husband's DC 37 plan, but will be living in another state?
If you're yes, short answer, you can take advantage of the dental, vision, and hearing aid, but not the drug plan.
Can I break in for just a minute, Sandra and Patrick? This is Sharon Persinger. I'm the PSC treasurer. I'm going to have to move on soon to another scheduled meeting, but
Right.
I just wanted, before and you can continue without me, before I step out, I wanted to just take a few seconds to thank all the panelists, Sandra and Patrick from the Welfare Fund, Yvonne Rodriguez from CUNY's Benefits Office, Misty Smith from the city's benefits program. I know that all the attendees here are overwhelmed with information, and I've been here as an attendee also, and so yes, I acknowledge there is a great deal of information here to process. We have presentations from the presenters, which we will make available to you. This has been recorded, and we will make that available to you. So watch your emails for follow-ups from this session. Those of you who are attending for the very first time, we have some printed information that you will be getting by regular postal mail. So watch your mailbox for that. And I just have to say, I know that it's all overwhelming. It is a detailed, complicated process, and everybody's situation is different. So you're going to have to do some reading and careful attention to filling out forms, and you'll have to talk to a large number of people. You'll have to talk to your HR office at your own campus, wherever that is, and you'll have to be in touch with Social Security and the Medicare office. There were contacts for all of those various places on the agenda that we presented when we first sent our package to you. And there are documents with details, documents, and a lot of this process in the package that we emailed to you. So I think we've been of help, but I do accept, because I'm in the same situation, I still have a lot of reading to do. I still have a lot of forms to fill out, and that's the way it's going to be. I'm going to. I'm speaking as again at this point as a participant, because I am at this time in my life also. I'm going to turn things over to Bill Friedheim, who is the chapter chair of the PSC's retirees chapter. I think is that okay to do now, or and I am going to be leaving. So thanks everyone, and attendees. I really hope we've been able to help in what is I acknowledge is a difficult process, but it's going to get you to a good place, which is that you will be able to retire and enjoy your life post-retirement, which has a lot of great and wonderful things in it for you. So goodbye, everybody.
Hi, Sharon.
Bye.
And then one last thing, because I've seen a couple of these things coming through. Pat, can you address the one big question that's coming through a lot is about the continuation of these benefits if the member dies?
If you die, your dependent survivors have the option of taking the Welfare Fund survivor benefit. And that survivor benefit includes prescription drugs, that SilverScript Medicare Part D prescription drug plan, dental, vision, and hearing aid. the rate is about $1,700 a year. That is much less than it would cost you to buy your own Medicare Part D drug plan. So your survivors have the option of getting these welfare fund benefits continued for life at the rate of about $1,700 a year. And that is a very good price for coverage that includes drugs and dental coverage and those free eyeglasses every year and a very big break on hearing aids. So yes, you can continue those benefits, but but the survivor will have to pay a very good rate on them, a great discounted rate.
I want to give Bill Friedheim, who's the chair of the retirees chapter, a few minutes to let folks know as they think about retirement about that chapter. Go ahead, Bill.
Hi, I assume people can hear me?
Yes.
Yes, okay. I guess I'm in the unenviable position of being the last speaker after 3 hours of talking heads and 3 hours of Zoom fatigue. I don't do a comedy routine. I don't have a song and dance act, but I can tell you something about the retirees chapter. A standing joke in the retirees chapter is that the 30,000 members like you, in-service members of the PSC, are retirees in training. Well, you've done the training. You're ready for the retirees chapter. You're ready for retirement. And let me just tell you, as somebody who's retired and has been retired since 2006, retirement is a very nice gig. The most wonderful part of it is time. Time for family, time for travel, or I guess time for travel post-pandemic. If you're so inclined, time for research, time for long postponed activities. And we hope that you're going to take part of that time in this new phase of your life to spend with your colleagues in the retirees chapter. Let me just briefly read you the mission statement of the retirees chapter. The retirees chapter is enriched by the collective wisdom and experience of 2,900 plus members as teachers, professionals, scholars, learners, trade unionists, and citizens of the world. Our goals are to draw on that experience, to strengthen our ties to a university whose curriculum, governance structures, and outreach to a diverse student body we help to build, to integrate our chapter's activities into that of a progressive academic union, to fashion alliances with other retiree advocacy organizations, and to safeguard and enhance the safety nets so vital to us as retirees: Social Security, Medicare, and health benefits, pensions, and the welfare fund. At our monthly meetings, we address issues and present speakers on academic labor, and on academic issues, labor, political, cultural, and economic topics that reflect these goals and are of interest to our members. The chapter meets every first Monday of the month. The exception is going to be November, when we're doing a retrospective on the 2020 election. The first Monday would be the second, the day before the election. The second Monday when we're going to do our meeting is November 9th. And who knows what we'll know on November 9th, whether there'll be a definitive answer as to who's going to be the next president, or legal wrangles, or people going to the streets. But we are going to do that retrospective. We also do two semi-annual luncheons, one in January and one in June, which will be resumed once we're beyond this pandemic. But on a bring your own basis, we did do a June luncheon and had a really electrifying speaker talk on the 100th anniversary of women's suffrage. And basically, we try to draw on CUNY scholars and professors as our speakers. We also have a number of cultural and social activities. A lot of this is going to have to wait for after the pandemic: walking tours, theater parties, a writing group, a movie group, and much more. And I'm going to be, I don't know how challenged I am, but I'm going to try to share my screen. And I don't think I'm going to be, hold on a second. Successful. I don't know what the problem is here. So I guess I'm not going to share my screen. What I was going to go to was the PSC website and the place where you can find out more about the retiree chapter, and that's psc-cuny.org/retirees. There's lots of information about the retiree chapter. I was also going to go to the page where you can join the retirees chapter, and you get there by going to psc-cuny.org. Click the tab About Us, and then the tab Retiree Membership, and you'll go to a page that now makes it easy to join the retirees chapter. You can do it online. You can pay by credit card. If you want to do it the old-fashioned way and send a check to the PSC, you can do that. But all that information is on that page. Dues are simply $85 a month, $40 if you're an adjunct retiree. That's annually. With your retiree dues, you receive the Clarion by mail, as well as the chapter's award-winning newsletter, Turning the Page. And with your membership, you continue eligibility for any benefits you receive through our state affiliate, NYSET. For example, if you signed up for catastrophic insurance through NYSET, you can only keep that if you continue to be a PSC member. And as a PSC member, you're automatically a member of our state affiliate, NYSET. I wish I could have shown you the...
Bill, I'm going to have to cut you off because being dependent on the digital universe, this Zoom is going to evaporate momentarily. So
okay, I won't evaporate, but I will sign off. So hopefully you'll join the retirees chapter.
Thank you. To all our attendees, thank you so much. Thank you, Bill. Thank you, Yvonne. Thank you, Misty. As has been said several times, this webinar is being recorded. Once we get it together, we will share it with participants. In addition, we will get the PowerPoints that were put up on the screens during the event and send that collection of PowerPoints to participants as well. So again, thank you very much for participating. This all takes work. It's a lot of individual decisions, but we hope this has started you down the road of thinking about what you have to do to retire. And I join my colleagues in wishing you a long, happy, and productive retirement, and stay well.